Okay, we don't see her. We don't see her. We don't see her. We don't see her on as attendees. No, we don't see her.
Might be trying to figure out if there's a shadow, I don't know. But mine is all okay. Yeah, that's my 135. So yeah. Yeah, I give it. Yeah, I'll figure out it. Yeah, I'll figure out what we're doing where there's like yeah, yeah.
No worries. Hi, I'm the tech assistant. This time I won't break out.
Okay, so we're saying we're gonna start at 5 minutes. Is Bethlehem on the session?
Yeah,
So far, so good. I can hear them.
pretty good. You look very awake.
You've been here all week, so
Yeah, I know.
gotta get into the room.
Someone who's been around me.
I'll take that as a good thing.
Yeah.
Has it been a good week?
Much better than it's like,
There you go.
you look
Yeah. And today I thought with that.
Yeah, that's why.
That's good. You're sharing a little bit. Indeed. Yeah. Thank you for coming. I think that's really, it's a long way. It's a long way. Also, like there was a push from the guest foundation as well. So this one.
Yeah, yeah.
Why this one? There's many comments.
One second.
I think they
Yes, we have. I'm struggling to log in.
Yeah.
No problem. I'm like, yeah, and who, we were like, we should just announce who the call on or something like that.
Yeah.
Okay. So. It's a late in December.
Oh, is that?
Yeah.
This, I have not seen them.
Yeah. Announce?
Isn't it that was announced?
No, it's not. This is for the public,
Oh, percentage.
Well, so this time maybe where they are.
Easier to do. Okay.
What other sources? So this is the right?
Yeah.
Like, yeah, maybe goes. GWSP, global water and Bank of the IIT. And that is also what is
Just in case we have an idea as we look in that slide, because I can go to you. Don't do that.
5 minutes.
Yes. I mean, it's just the idea of what I put people and the thing works, it's just like, here's how we're getting it. And I mean, we have people and
People first.
Yes. But it's, I think the morning ones are so, these people sign at 8:30 a.m. or something.
Yeah. We didn't get a bell until 8:40 yesterday.
Oh.
I don't know if they were late. We started.
I think they just ran it for 10 minutes to try and get everybody out.
Yeah.
Takes a good.
Let's go around
Yes,
there.
yes, okay. People
Because
are-
some of us are just leaving breakfast.
Yeah.
Because usually I usually took my breakfast to most meetings,
Yeah.
so I'm going in much, so.
Okay.
Hi.
Hi.
My pleasure.
And the tech assistant.
You were in the-
You will be here with us in the training.
Yes,
Awesome.
yes, they
Where
were.
can you-
Fiona, but I'm gonna, after the next, I'm gonna come and find you so that we can chat. Yeah.
Oh, yeah.
Okay.
That was great.
By the way,
Sorry, Wendy.
well, I mean, I will guess.
Nice to meet you. Wonderful people.
that I just know.
Yeah.
Okay.
How do you do?
I am now. Is it? Yeah. Hi, is he on?
Kate Fogel.
Just missed her,
Oh.
although we have interacted, she's done a little bit of like translation and things for us
Is that in my phone now?
after she departed.
He was like that.
Yeah.
Oh, cool.
I've certainly heard her name. I've never met her in person, but,
What's your role?
I'm our director of partnerships and policy. That's up a couple months ago, so new role. I was working with our Africa country teams for the last 5 years. But based in Colorado.
Oh, yeah.
Denver.
Actually, what ISP from the partnership, which is now.
Right.
the-
Maybe one.
Okay. Yeah.
And I'm sure they're working with God, it's really the work that people want. Understand the reason.
And so, sorry.
Yes.
Yeah. All right. Yeah, I know some of them.
Okay, so
That's
here's
the
what I can do.
sustainable systems.
I can just join your social virtually.
So I supported a little bit.
I also want to see that series.
BET slide actually.
Started this.
Yeah. And again, you are allowed to mics around and everything, so as soon as you're ready, you can start.
Still separate, but they-
Still separate. Exactly. Agreed. It's very much common results.
Good morning, everyone. It is day 4. I'm super grateful for all of you who are here in the room with us. Thank you. And those who will be joining us virtually. My name is Deepa Karthikeyan. I'm part of an organization called Athena Infonomics. We're an impact services group. The session today, the title sort of really called Strategic Service Plans, Frameworks and Field Experiences. It's inspired by a dialogue that started earlier this year, actually. First within Athena, because we started supporting a utility with their sanitation master plan. And in starting to do that, we started saying, oh, wait, and they said, can you give guidance to provide to this particular master plan and think about how it can help strengthen the city as a service provider? And as we started looking at the plan, we started saying, oh, wait, there's nothing in here about the city service system. There was nothing in there about what systems the city needed to put in place to effectively deliver or to set them up for success as a service provider. And we know these problems. It's been discussed a lot at UNC here. It's been discussed outside of UNC, which is we tend to equate infrastructure targets to service targets over and over again. So this is almost this oversimplifying. This is like saying, if I gave all my team members at Athena Infonomics a phenomenal laptop in a beautiful building, they will be the best consultants and will deliver fantastic services, which is not the case, right? So you need systems that will set up these organizations to be effective service authorities and service producers. And we know that. So we know the problems, we know the solutions. But why doesn't this happen? Because we don't invest in systems. We don't invest in strengthening financial management and accounting systems in governments. We don't invest in strengthening human resource management systems. So the conversation today really is not to go back and revisit the problems, because I think for those of you who are here at UNC or those joining us online that are interested, we've talked about the problems a lot, right? We've talked about the political economy challenges of investing in visible assets like infrastructure as against investing in service systems. And, service system investments always get deprioritized. We know that there are challenges in measuring performance of what a good system looks like. How do you decide what the right first move is? So really the conversation today is to start talking about ways in which development actors and public sector agencies are thinking about these questions and are trying to move forward. So we're not going to go back and talk about the problems, and we're not going to talk about checklists and frameworks and these codified solutions as sort of like general things that work everywhere, but instead, this is an opportunity to listen to practical experiences from agencies, from public sector leaders. We're hoping we have Bethlehem from the Ministry of Ethiopia, who's been leading an incredible technical assistance program in setting up cities for success. She's having some difficulty joining us online, so we're trying to get her online. So hopefully we will have her soon. But really the focus is that it's really talking about what are we doing already to address how are we setting up cities to be successful service authorities? And what are some of the frameworks that organizations like UNICEF and UN Habitat are using to help sort of advance this? How are they then working and guiding countries around the world with frameworks to help sort of a certain level of consistency in thinking and learning from these experiences and scaling it up in other places? Today, that's mine. Yeah.
And, your colleague is joining.
Excellent. Do I just, is this the,
Yes, it should work. It doesn't.
okay. I don't see. Okay, great. So here are a couple of themes that I think our colleagues are going to touch upon as they're talking about what they've done somewhat differently, or what they've done to make plans or make plans succeed better, right? So one of the first themes that you will hear is really how do we think and work politically? Because services, and a lot of the examples that you'll hear today are from the sanitation sector, but I think they're just as applicable for a lot of urban basic services beyond sanitation, right? So the first thing is how can we think and work politically? Because services are, the mandates for services are fragmented or split or fragmented, and we need to engage with different interests and influences strategically across the planning process to make it successful. How can we understand and intervene to build service systems? And I mean, and be tactical about it. You know, I had I had an interesting conversation with one of the panelists that said, let's start by just building systems that help operationalize already existing legal mandates, right? Like, let's just go back to what you're legally obligated to deliver as a service authority today. And that's maybe a good place to start with, and will help sequence what investments you make. And let's get that right. And then we can start building further from there. So how do you start thinking tactically about where to start and where to go? How do we build more intentionality on outcomes and trade-offs? Because right now we're leading with influence. A lot of plans say, oh, I'm going to build X kilometers of sewer networks. I'm going to augment the wastewater treatment plant by a certain amount. But what are the implications of these investments? What happens when you take $150 million and put it in a wastewater treatment plant upgrade? What are the implications for equity? What are the implications for financial viability? What are the implications for the environment? And I think we don't lead with an intentionality on that. We lead with, oh, if I can, I'm going to maximize the total amount of money I'm able to access, and then I'm going to just put in as many pipes and pumps in the system. So how do you lead with an intentionality on outcomes? And what is the accountability, and what is the way to think about these in a way where they're living documents? And that's more than saying, oh, we're just going to do, it's really thinking about very practical mechanisms to review where cities are and think about what needs to be done to review and sort of update these plans, to recalibrate. We all do this. It's not uncommon for us to go back and say, these were our targets, these were the systems we wanted to put in place. Where are we with respect to that? And what are the mechanisms? So not just the idea, we all know that we love a good M&E system, but what are the mechanisms that will enable it? So that's the focus of this session. The session really is, what can we learn? And is there a dialogue that we can start and continue around what are ways to systematically think about interventions that accrue to setting cities up for success, and the role that plans, whether it's a city sanitation plan or a city service plan or a utility master plan, the role that they can play in advancing that. So we have an amazing panel. We have Miss Bethlehem McConnell, who is a sanitation infrastructure M&S desk head with the Ministry of Water and Energy with the federal government of Ethiopia, who's joining us. She's going to be joining us online. I want to just, Bethlehem, can you hear us? I want to make sure Bethlehem is the one we had a little bit of difficulty bringing into this, but I'm hoping she will join us shortly. We have Alan, Mr. Alan Kurunziza, who is the Senior Urban Sanitation and CWIS expert with TA Hub for Citywide Inclusive Sanitation. Who will tell us more about what the TA Hub is when he speaks. But Africa, Alan, can you hear us?
Yes, I can. Thank you, Deepa.
Maybe you could wave to can you see us and hear us?
Can you hear me?
Bethlehem, yes, we can hear you. Hey, Alan.
Really?
Yes.
Yes,
Yay.
but I need to have, I need to make it a bit louder. I'm
We can
trying
hear
to look
you
for,
loud and clear, Bethlehem, but I can't see you.
for me to hear your voice actually, Deepa.
Okay.
Okay, great.
Excellent. Excellent. I'm so excited that worked out. And then we have Mr.
Finally.
Yes, finally. We have Mr. Syed Adnan, who's a WASH officer with UNICEF Bangladesh, who's joining us here in person. Thank you so much, Adnan. We have Andrew Knockout from UNICEF, who's a WASH specialist with sanitation in UNICEF, who's also joining us in person. Andy, it's great to have you here with us. And Mr. Simon Okoth, who's joining us from Nairobi in Kenya online. So we have 3 colleagues joining us online and 2 that are here in person. A lot of the examples that you will hear today is really from the sanitation sector, but really as I step back and think about it, these are governance questions and conversations, and I think it's just as relevant for any other urban basic services. With that, I'm going to Bethlehem, actually hand it over to Bethlehem first to talk about a really interesting technical assistance program that she's leading in Ethiopia. This technical assistance program is doing some really incredible things. They're working with just a small network of 11 cities to begin with, but the goal is to think about tactical interventions that sets these cities up for success in terms of service system strengthening and creating these really interesting national accountability mechanisms to track and update plans. So with that, Bethlehem, over to you, and I'm going to start sharing your slides. Bethlehem, feel free to tell me when you want to go to the next slide. Can you see the slides?
Hello. I have already shared my screen. Can you hear me, Deepa?
Yes, Bethlehem, we can hear you, and your slides are up for everyone to see. So I can move your slides. You can start talking. Can you see the slides, by the way?
Me, yeah.
Great. Please, over to you, Bethlehem.
Okay, thank you very much, Deepa, for giving me this opportunity, the ministry to show what it's doing in terms of supporting cities and regions. I think first I would like to can you Deepa, can you move to the next slide?
Yes.
Yeah, I would like to give the context. Sorry. Sorry.
No worries, Bethlehem. Please go ahead. We can hear you loud and clear.
Sorry, I think I have shared the wrong slide, and I have to
But then feel free, you can just talk through the ideas and it's okay if the slides, it's okay. You could just talk through the ideas.
Yeah. Sorry.
No worries, Rod, please go ahead.
Hello.
Yes, go ahead, Bethlehem. We can hear you.
Okay.
Should I go to the next slide? Do I?
Okay.
Would you like to continue?
Yeah, but I'm sorry, Deepa.
Do you want to just talk extempore without the slides? Do you feel like?
Yeah, please.
Just go ahead and talk about the ideas. I can take off the slides.
Okay. Sorry for the inconvenience, but I would like to show you, our ministry is trying, Ethiopia is approaching a decentralized service delivery system as a federal state. Critical functions like water, sanitation, solid waste, and public health services have already devolved to regions and cities. So the main focus of the ministry is strengthening of the local localities through capacity building and technical assistance for effective and efficient service delivery. The government of Ethiopia has already prioritized sanitation improvement as a key component of urban and rural development and for social economic transformation. And, we have already committed for achieving sustainable development goal, especially the target 6.2 by 2030. Sanitation is everybody's responsibility. It's not only the responsibility of one institution. And with this principle, the sanitation is being addressed with multi-sectoral approach, and it's a multi-sectoral development issue in Ethiopia. So MOBI is currently leading and coordinating activities on urban infrastructure development and service provision for drinking water, supply and sanitation services in cities. This is a core function which is devolved to regions and city authorities. So as a priority steps, there are main two options which should be operationalized at both regional and city levels. The declaration of open defecation free Ethiopia through the ODF campaign, which we expect to be launched recently, and also the development and implementation of sustainable sanitation service delivery models and interventions along the sanitation chain. When we take MOWI, MOWI is currently strengthening its own capacity and also leading and pushing this reform in terms of taking the accountability and responsibility on sanitation to consolidate and the devolution with clear responsibility and accountability on urban sanitation service improvement. We are working regions to have this structure. So as a good example, we can see MOWI recently have established the institutional setup to take over the roles. So when we come to the focus area in terms of strengthening the system, the sanitation system service in the cities, MOWI is trying in terms of developing the national, regional, local mechanisms for benchmarking and evidence-based action, like creating accountability systems, feedback loops, and resource to track and fund for improvement of the sanitation services. And also in catalyzing inclusive urban sanitation reform through city authorities. And we are also trying to help the national government in terms of facilitating reforms through capacity building and technical assistance. But we need to have the capacity building and technical assistance to be scaled up to be applied on a wide scale. So when we come to the citywide inclusive sanitation approach for Ethiopia, for sanitation improvement, you know, the framework emphasizes on sanitation service utilities to be responsible and accountable to execute the public mandate for inclusive urban sanitation service delivery by assuring resources are effectively and efficiently managed to support execution of mandate. I hope you can hear me, yeah?
Yes, we can hear you clearly.
Thank you very much. I just would like to check for the network. And also, you know, the realization of equitable, safe, and sustainable sanitation service delivery through, responsibility, accountability, and resource planning management. We are trying to implement this with the support of the Technical Assistance Hub of Africa, with financial support of the Bill and Melinda Gates in the 22 cities, which actually, urban cities, particularly.
Again, we lost you. Bethlehem, can you hear us?
Hello?
Yes, we can hear you.
Thank you very much. Okay. So we are trying to initiate and try to develop the process of supporting the cities in implementing the CWIS approach, and to try to implement what they should be doing in terms of improving the sanitation services. With this regard, for example, we are really trying to push cities to think politically, and of course to take responsibility and accountability. To do so, we have done some citywide inclusive sanitation implementation baseline assessment, and try to map the actors, such as identification of relevant institutions and stakeholders, assessing the regulatory system within the cities, the institutional setup, the role and responsibility of the actors in the service, and also the coordination mechanisms both in the cities, regions, and the federal level, and also try to understand the role of the private sector. And also, within this baseline assessment, we have tried to see the adequacy of the infrastructure, the service along the value chain. And we also try to help the cities to bring to come up with performance improvement plans for the improvement of the sanitation in terms of prioritizing, mapping and prioritizing the interventions by critically looking into what should come first and this kind of things. And also in terms of calibrating the responses and PIPs to meet cities, whether they are sanitation, the challenges in the different cities is quite different. So one kind of approach is not fit for all. So we try to support the cities to understand their contextual situation and come up with some kind of solutions. And also regarding a national accountability framework with clear feedback loops to track and incentivize reform at the local level. The first thing that we want regions to have is the institutional setup. We want departments being created in the regions and cities and utilities, which is really dedicated to take responsibility on the sanitation services. And also with the CWIS technical assistance project, we are also trying to develop sanitation service indicators, because in general, in the water sector, they have this indicators developed, but for sanitation, we really need to have these indicators to strengthen this accountability framework. And also, we would like.
Sorry.
Hello.
Yeah. Can you summarize in 30 seconds?
Okay. Yeah. So this is what we are trying to do, but there are a number of challenges that, despite our efforts in doing so, there is a limited capacity at all levels. There is a sanitation structure challenge, and also there is a lack of regulatory mechanisms. And also, we would like to strengthen the management information system for sanitation. So in general, we would like to do a lot of things, but it is quite interesting that currently with the available resource and capacity, we are trying to support the regions. This is what I have from my side. Thank you, Deepa. Over to you.
Thank you so much, Fatima. Thank you very much. And there's no way we can do justice to the amount of work that the ministry has done and the leadership they've played in thinking some of these bits through in 10 minutes. And thank you for that, Bethlehem. I think the most one thing, and I leave this for those of you interested, Ethiopia is looking at an interesting set of qualitative metrics to track whether a city is changing its service systems, right? So, and take India as an example, a simple question like, are you shifting from a single entry cash-based accounting system to a double entry accrual-based system changes the way you manage services. So rather than focusing just on a set of quantitative metrics, I think there's going to be a big focus. And again, there's no capacity to generate quantitative data. So rather than having accountability systems, again, ask for data on quantitative stuff that nobody has the capacity, resources, or systems to generate, can we start with some of these qualitative questions? And I think the leadership provided by the Ministry of Ethiopia has been incredible. Thank you again, Bethlehem. With that, Alan, over to you to talk about the vision and how, because this is funded by the TA, but the vision behind this. Alan, over to you to walk us through your vision and how you're taking this to countries elsewhere.
Thank you very much, Deepa. Good afternoon and good day to everyone in the hall and all those that are participating virtually. I'm quite pleased to be a part of this session, of this conversation. on the systems that are needed to take our sanitation space go forward, particularly to talk about the TA hub as a technical assistance hub for Sub-Saharan Africa. Permit me to start by introducing Cabinet ADE, the firm that hosts the TA hub for Africa in Senegal, Dakar. It has a footprint in over 25 countries and has expertise in the sanitation and environmental health sector. Next, please. So what's the Tier Hub? Tier Hub is a program that is funded by the Gates Foundation with the goal of supporting governments like Bethlehem in Ethiopia has just been sharing, as well as development financial institutions to advance urban sanitation solutions to the various challenges that we've been hearing during this conference, but also that we're aware of generally, by mainstreaming the citywide inclusive sanitation approach in project design, in sanitation programming and implementation in Africa. And I'll briefly describe how we're doing that. But first, from the sessions that I've attended during this conference, a few key themes have come out prominently. And one of those is the realization that we may not meet the SDGs if we only look at the infrastructure only, but that we need to look at all the various building blocks that enable a sanitation service or water service to be delivered, especially in our urban contexts, where the risks get amplified should these systems fail. And so this slide shares the building blocks for a sanitation service as we understand them. And again, these have been shared during the conference. Just so that I don't sound like a broken record, I won't go through all of them, but just to highlight that these building blocks are very essential for the provision of sustainable services going forward. The tricky part, though, is that for many governments, it's very hard to try and incorporate or follow this, mainly because the political economy mainly favors the building of assets and not necessarily how those assets interlink with these building blocks to ensure that there's a sustainable service that is being provided. And this, for if I start with governments, mainly results from the challenges that Bethlehem has shared around the institutional mandates, around the policies, around the financial incentives, the markets, and so on. But we also find that on the side of the DFIs, some of these aspects are also not that interesting, mainly because of the long-term nature of some of these investments. So institutional strengthening is not something you'll do overnight. It's something that needs a progressive effort over a period of time. And sometimes this is not very attractive for the DFIs. And so we see that that we get caught up in that gap where on the one hand, as Bethlehem shared, the need for capacity building is very big, very huge, and very urgent. But on the other hand, the support may not be coming through because the internal resources are not available, but also for the would-be partners, it's not an area that would be of great strategic investment. And so this is a space that the TA Hub sits in and occupies to try and support the governments with those aspects of capacity building and planning that would support the infrastructure investments that then the DFIs would bring in, but also support or work with the DFIs to try and invest in those areas that ordinarily wouldn't be attractive to invest in, with the goal that between the DFIs and the governments, you then get a consensus on how the investments for sanitation, long-term sustainability being one of the key goals, could be done. And so for governments, that means talking about the institutional setups. It may involve discussions around changes in policies. It may involve discussions around the markets. So these are all areas of intervention that the TA Hub then works with governments and DFIs to then try and firstly prioritize what are those areas of investment that would be the key areas to start off with. And here the key thing sometimes is not really going for the big, issues, but starting small. Deepa talked about developing service plans. It may look at something very simple, but having that plan helps two ways. First, you then have a reference document that will guide in how you are going to invest in a city at a national level, but also the process of developing that plan, bringing all these stakeholders together, different institutions, different professions, and agreeing or getting to a common consensus, I think is also very, very useful for many of the contexts that the TA Hub works in to arrive at progress in the sanitation space. And so I won't dwell a lot on that slide, but it's really showing some of the areas, the countries where TA Hub has operated and the kind of projects that they have done. But the key things is really facilitating those conversations, providing that opportunity for different stakeholders within a country to deliberate and agree on a way forward, looking at both the hardware and the software aspects of the sanitation system. And as I start to conclude, I would say that one of the key things that we've picked up in these assignments has been the value of data and evidence to guide these conversations. So that can't be overstated. Bethlehem mentioned the baseline surveys that are carried out. She mentioned the indicators that are used to track. So these are very key. Data has a very crucial role to play in that. The other, and I think is very important, is about leadership. And this is why I really wish to commend Bethlehem for the leadership that the ministry is showing in Ethiopia and also in other countries where we worked. We've really seen some champions emerge from the public sector to try and advance and take this law. It's very, very crucial if we are to gain any advances in sanitation. And last but not least is also the involvement of the young professionals and the women professionals in the designing of these programs, in the implementation, and in the tracking thereafter. As Deepa mentioned, we can't do justice to even a case study like Ethiopia's of what has happened, but this was just to really give a snapshot of how the TA Hub approaches sanitation programming in various countries that it operates. And I'll be available for any other questions after this. Thank you very much, Deepa. Back to you.
Thank you, Alan. I mean, so the whole idea of the session was to go experiences and frameworks, right? Like, what are the things that people are doing in the field and how are they moving the needle and what are the frameworks that support it? And I think what's also, and Alan alluded to this, is amazing is that the TA Hub operates at the intersection of DFIs and governance. So on the one hand, they're actually building capacities of the board, let's say lenders and borrowers. They're talking to borrowers to sort of build capacity to say, how do you think about these long-term investments and build that into your negotiation packages better? And how can then the DFIs be more responsive? And I think it's really unique. Thank you so much for that brilliant presentation. With that, I'm going to now hand it to UNICEF. And we have, again, an interesting combination. So we have Adnan, who's going to talk about the work that they're doing in Dhaka, North City, and how they're thinking and shaping those plans to address questions of equity, but also to think about some of these structural gaps in the system. And then Andy will come and talk about how UNICEF and under their game plan are looking to scale and think about this approach in countries elsewhere beyond Bangladesh. So Adnan, over to you.
Yeah. Thank you, everyone. So now we come back from online to offline for our presentation. And actually, I'm going through about the safety management edition and how the mega cities and what is their infrastructure and investment and how the other elements and the responses required to make those investments more effective and meaningful for city sanitation improvement. So I will not go through very in depth with the sanitation letter. So we all know here. So when the SDG set the target about the safety managed sanitation and main problem arise for the government to understand the overall chain of the sanitation. So if you are not the sanitation professional of the sector of the sanitation, so this is little bit difficult for them to what is going on after flushing your toilet. Right? That's why we have to give a lot of attention to address those things. So that is the main challenge. And when the sanitation service chain introduced and it's come from your capture to your treatment part, so it goes beyond of the one agency task. So now there is the multiple agency required and multiple agency required to be work together to reframe their structures and the working space to address the thing. So this is the challenges. And very quickly, if you look at the statistics of the Bangladesh about the safety managed sanitation, so recently one study conducted. And if you look at the national level, rural level, and the urban level, so in the national, like 50% of the population, they are using safely managed sanitation in terms of the pit latrine or on-site sanitation facilities. But if you look at the capture to the treatment part, so now it's turned to only 10% populations who are under the sanitation service chain. And rural is almost higher than the national statistics, and urban definitely it's suffered than the rural. But interesting like that, if we come to the urban itself have a lot of difference inside the urban. And if you divide the urban, like urban have the rich people, urban have the poor people, urban have the informal settlement, urban have the low accessible settlement, urban has the climate impacted area. So if you divide the urban sanitation inside the city or the municipality, then you can see in the residential area, the slum. So there is no big difference between inside the city. The rich people who are living, so they have the facility of the septic tank or on-site sanitation, but what they're doing for the malfunctioning of your septic tank and your technology, they are also disposing their all pieces to the environment. So in terms of you have a fancy toilet, but for the safety managed sanitation contribution in the city, so they are almost same as the low income community. So this is a very interesting part you can see. So for the citywide inclusive sanitation or the city sanitation, so we cannot think only about the low-income community and address their problem. It has to be comprehensive at the whole city. Otherwise, the rich area, wealthy area, so they are also dumping their waste to the low-income community, and that is creating double burden for them for the living. So it should be the address for. And to first is that then what the government is doing. Are they doing something to address those problems? And definitely they understand the thing. And for the Bangladesh government, for the mega city in the Dhaka, where it is about your 17 million people living. So they come up with a very comprehensive master plan. And they divided the whole city with the 12 catchment area. And they also leverage the fund from the IFIs and others. And they start to think it should be the infrastructure driven, and it should be the centralized waste system will place. And within this way, we can solve our overall problem. And that is the right way to think in long-term part. And recently, so they already inaugurated one city, which is one of the largest for the South Asia, and another is on the renovation part. But what is the result of your infrastructure part? If you look at the statistics before I show, so till now, those are not contributing to change your environment and the safety and sanitation. And then the discussion came for the sector and the government. So what is the lacking and what response we have to talk up to make those investment and the big infrastructure to get their efficient outcome, right? So as a government and the sectors, so first response it came. So we realized like there is the infrastructure, but this infrastructure and the service provision is not properly supported by the policies. So what is the existing policy we have? It have to be addressed and it have to be revised and realigned with the safety management sanitations. Before policy said, if you have the toilet and if you have the pit latrine or the septic tank, we are happy. But now safety management sanitation is pushed more than your just a simple containment system, right? So from the capture to your totally treatment part. So policy adjusted those all changes, and how and which agencies would be responsible to deal that one, they address now. And now the all agencies, so they know actually what is their role and how they could perform and interact with the other agencies to get the overall objective of the safety management sanitation. So another thing is after the policy revision part, so it comes to the institutional restructuring. And the government developed the institutional regulatory framework. So that is another very specific policy guideline that now the water authority, city corporation, like the local government, like also the Ministry of Education, Ministry of Health, each and everyone divided their tasks. So who will do what is and their boundary work. And also government acknowledge and endorse that not only the government agency, but the safety management sanitation, so they need to involve the private sector heavily. So without the private sector and they are vibrant, present in the city for the service mechanism, it is not possible by only government to address this one. So policy also address and also invite the private sectors and giving the proper enabling environment for the private sector to step in and invest and collaborate with the government for the service improvement. So then the thing is like policy is there, infrastructure is under preparations, but the people who have the behaved before to think only about their toilet, now they have to shift their mind about think about their pieces and how their pieces is contributing at the environmental pollution, the overall water body pollutions and the neighborhood pollutions by the whole service chain. So then the city authority and definitely other two speakers also said, so you need the leadership. So only leader can change your mind to think in new direction. So Dhaka city and their city corporation mayor, so actually he picked it up and we start the mass campaigning to the peoples. And then the questions came, so how they are doing the malfunctioning on the city like they have the septic tank, but it is connected to the drain and the strong drain. So it is no meaning for this investment and the things, right? So this advocacy is continue ongoing. And then the public, the first action when they say that you have to take actions and you have to engage to help the government to overcome the safely managed sanitation goals to achieve. Then the question came from the citizen like, I know, okay, now I know about the how I am polluting the environment, the water bodies and the things and health, but what is the technological solution? So if there is no technological solution, how I will comply with the city? Because city has the only one provision, this is the centralized sewage system, but this is just newly constructed, not connected with your household. So second, you have the septic tank, but the city don't have any provision for the dislodging. So what I will do rather than connecting to the drain. And this city has no other technology or low-cost technology that I can adapt to make myself complex. So this is not only the people, this is not only the authority, this is the overall chain of the thing, the technology, peoples and the sectors have to play together to achieve the things. So the second, then the quickly authority responded and they've come up with a vision, with a roadmap, how to integrate the private sectors, the public sectors, institutional reform, and also to engage the people. So now they have the clear vision and they are moving this vision to achieve by 2030 that city totally safety managed sanitation. The response 3, like now the authority between the develop a STP for the city. For that catchment area, it will be take for network connection maybe still 8 or 10 years. So what will be the intermediate solutions? And the now city is introduce the service provision for the scheduled dislodging, and they are going for the scheduled dislodging as an intermediate solution until your household is connected with the centralized sewage systems. And in this way, it could be monitored and regulated the whole service chain for the part. And also like one learning through the centralized sewage system, one technological solution, the scheduled dislodging service provision government provided, but still this all solution is not suitable for the low income community where people cannot get the sewage connection or not their containment is ready for the scheduled dislodging part. So at that part is government is now trying to adapt the different technology to restructure their drainage system and try to trap the fecal contamination through that filtration in the drain from the water body and the protect the their natural resources. So this is the 3 different service provision is coming on the demand of the part. And also like the private sector engagement, government from the high level, so they are continuously giving that different transformative technologies coming on the globe and introduce those transformative technology to the market that who are at the higher quintile and who could adapt and the commercial space and institution, they have to treat their pieces at source. So that is the regulation is changing. So by the different dimension of the service provision, public engagement and the private sector engagement, so government is responding the things. And thanks from my side. And this is the part for Bangladesh, and this is also reflecting to other mega cities. Is government vision from the next year. They are trying to open up the different and multiple service provision for the city to make it effective. Thanks.
Thanks, Adnan. I also want to just remind the audience that there's going to be Q&A, and I like what they said in the plenary. Feel free to be, was it provocatively constructive or constructively provocative? I forget. But just feel free to ask us difficult questions. I ask the panelists difficult questions, and please feel free to write that down because we're going to have a Q&A. I'll invite Andy to now talk about how, UNICEF HQ is helping think about this and take it to different countries.
Thank you, Deepa. Yes. Thank you. It was great to hear from what my colleagues doing in Bangladesh in more detail and how that relates to what we're doing at HQ. So my name is Andy Narapa, I'm wash specialist at UNICEF HQ. And our role, so UNICEF works at HQ and we have 6 or 7 regional offices and about 150 countries. So there's a HQ role is to support with global advocacy, sharing our knowledge, but also frameworks, strategies, and bringing the latest thinking to our country offices. So I'm just going to sort of briefly talk about the evolution of where we are now with safely managed sanitation and how that links with what you've just heard from the country level from Bangladesh. So UNICEF, from about, we all know these statistics, like the global progress towards the Sustainable Development Goal 6.2 is wildly off track. It needs 5 times acceleration. We've heard all these daunting figures before, but the message is, how can we accelerate progress towards safely managed sanitation? And the UN Water around 2018 brought out this Sustainable Development Goal accelerator framework, of course on the left, and it had these 5 accelerators that encouraged development organizations and governments to work together around these 5 pillars. That if concerted action was worked on these 5 pillars, which you can recognize are quite similar to building blocks and other other enabling environments, the way it's broken down, then we're likely to see more rapid progress. So in that light, UNICEF released its game plan to reach safely managed sanitation. From 2020 to 2030, it's all, so UNICEF has for a long time been quite on the, if you think of a spectrum from service delivery, as in building toilets, to supporting government to build toilets, that spectrum, we call that supporting government to be upstream, system strengthening. We call that downstream service delivery. And I think that the sector has, over the last 10, 15, 20 years, has moved from service delivery, so development partners going in and providing service delivery, building, sinking boreholes and providing toilets, etc., towards more moving upstream and supporting government in their role, because that's how you achieve scale, is to support scale, and that's government's structures. So UNICEF's game plan is all about putting government in the lead. It's about working upstream, engaging the private sector, but recognizing that sanitation is a public service. So supporting government to put in place those structures for the private sector to deliver. And it's about collaboration, which again, UNICEF probably was not so collaborative, working in rural areas when, that perhaps there were no other partners. It was just UNICEF and implementing partners. But in urban, you have to work in partnership. It's a very more complex environment than a rural sector. So this is this conceptual framework of the game plan. It's about those 5 pillars to support a robust service chain. And this is, we know that sanitation is meant to deliver public health, public and economic and social benefits. But for so long, the sanitation, the way it was being delivered, was not achieving those public health objectives. And that's because we know it was all about delivery of basic sanitation and not thinking about where does the excreta go, and recognizing that excreta is leaking out of that sanitation chain at all points, from unclean toilets, overflowing pits, to informal and unhygienic emptying services, to underperforming treatment systems and unprofessional or maybe unregulated reuse practices. So to deliver to make a rigorous sanitation chain that contains the waste and doesn't leak out to the environment and make people sick, we need these strong systems, and that's what we are. That's our sort of framework for supporting governments is these 5 pillars that you saw on the previous slide. Those 5 pillars are in a robust policy environment for that. It's a robust policy environment, financially viable services, data and information, government-led data systems that informs the risk and helps with decision making, a competent sanitation sector, and an innovative sanitation sector as well. So that's how we think about it. I'm sorry for this slide, first of all, but I'd like to point out the orange line there, which is how this implementing the game plan. This is basically the urban wash framework of how we described it at UNICEF that came before the game plan. So this was UNICEF, we work in rural, now we work in, we're moving into urban. So this is how we think about urban, and now the game plan encompasses it all. So we work at the sector level, so sector national level. This is at the national, supporting policy, strengthening the actual policy at the national level, supporting ministries. With finance, it's maybe financial plans and investment plans for infrastructure that work at the national level. With data, it's about national data systems, about a centralized database, and in capacity supporting the national ministries, national statistics agencies, regulators, national regulatory framework. But at the service level, that's where the services are delivered. That's at the subnational level, that's at the district, regions, municipality level, and that's about, again, using that 5 framework for policy. It's about implementation of policy. It's about implementing regulation for at all levels, you know, all moments along that sanitation service chain, regulation. Finance, it's about domestic resource mobilization, so making sure that budgets are accounting for sanitation service delivery. The data, it's about making sure that the data is collected on the ground within services, etc. And then user level is ensuring that users know their rights. So I'll leave it there. That's how UNICEF is thinking about conception, how we're scaling it to many different countries and providing that support for UNICEF offices to support stronger governance systems. Thank you.
Thanks, Andy. Now we have Simon. This is the last presentation for this session, but incredibly interesting because he's going to talk about one of the most complex things that we're all constantly trying to think about, which is how to think and work politically in situations where we have fragmented and split mandates, and how to get cities and utilities to coordinate better where you have different service authorities, but also how to get cities to think about sanitation within their larger urban basic services. Simon, can you hear us?
Loud and clear. Can you hear me?
Yes, loud and clear as well. Can you see the slides, Simon?
Yes.
Great. I'm happy to help you with the slides. So please tell me next, and I'll please, Simon, over to you. Simon, I don't see your video though, but
I'll try, although I suspect that I may land in trouble with my network.
okay.
So I'm trying to keep safe. So so far, thank you very much, Deepa, for inviting me into this session. This is a great work and great presentations from my colleagues. My name is Simon Okot. I come from UN Habitat. And straight into the matter is that UN Habitat's work includes transformative change in cities and human settlements through knowledge, policy, advice, technical assistance, and collaborative actions to ensure that no one is actually left behind. And we very much work with the urban authorities and urban planning, urban development departments to ensure that all this work that we do become effective on the ground. And so part of the commitments of UN Habitat includes also work within the WASH programming, where we are very much active and we are committed to universal access to safe and affordable drinking water for all and sanitation for all in order to meet SDG 6.1, 6.2, and also 6.3. And so we look towards engaging strategies such as citywide inclusive approaches, equity and social inclusion. And this is how we find ourselves in the sanitation space. We do recognize the scale of the urban sanitation challenge, where we have this disproportionate burden in terms of urban poor and the marginalized not being able to access or making very limited progress towards achieving the SDG goals on sanitation. And this prompted UN Habitat to launch a program on citywide inclusive sanitation, where we were looking at 3 key outcomes: 1 on data, 2 on integrating policies, sanitation into urban development policies, and the 3rd one being focused so much on global exchange and knowledge management to ensure that there is enhanced capacity in the sector. So why do we talk about coordination in sanitation? One thing that prompted us to think towards coordination in sanitation is the fact that the progress towards SDG 6 is actually very, very minimal. It's really lagging behind in terms of progress being made. And as such, we allude to the global SDG 6 acceleration framework, which in its good intentions was meant to ensure that we make good progress towards meeting the SDG 6. And so this has not been quite the issue, and I think Andrew did made a good reference to this. And so in the recent past, after the UN 2023 conference on water, there came out a blueprint which also points out to the need for strengthening action towards achievement of the SDG 6. One of the challenges that has come out very prominently around this is the fact that sanitation is quite a complex issue that requires involvement of a number of entities, but also at the same time, it recognizes that we need to reduce policy and institutional fragmentations between levels and actors so that we are able to realize harmony towards improving governance, so that these other accelerators, including data, investment, innovation, can find it easy to cascade onto the ground. And so UN Habitat initiated an assessment just to try and understand what could be the bigger issues that surround urban sanitation in terms of policies, because seemingly policies are in place, but apparently these policies doesn't really reflect what you find on the ground. And so this assessment was specifically looking at, given that sanitation service provision cuts across several sectors and bestows a lot of responsibilities and mandates on different agencies, both horizontally and vertically, from national levels to the local levels. What is it that it means when policies and institutions are fragmented in terms of what they perceive and what they plan for sanitation work? So this assessment was conducted in both Kenya and Nepal, and we'll move straight into the next slide, Deepa. Yes. So some of the elements that were very fast to be looked at included what the two countries had in terms of sanitation-related policies, laws, and strategies. And the landscape was quite, the ordinary one, where you find that a range of policies, laws, and strategies are domiciled within different ministries and different agencies. And so besides the fact that in the two countries, their constitution really talks about sanitation, it's entrenched in these constitutions as human rights that needs to be addressed by the governments. And so the different other ministries borrow a lot in terms of their laws formulation from the express direction given by the constitutions. We also looked at how the ministries are sitting, how the policies sit within the ministries. And we also realized that similar in both countries, a number of ministries have policy provisions and are seen to be involved in some sort of sanitation work, either as a whole or in the elements of sanitation value chain. So this was demonstrated at the national level with the different ministries, Ministry of Water, Health, Forestry, Environment, Urban Development, all making clear references to sanitation. In terms of regulatory framework, the authorities are spread across the national agencies in both countries, and so also with a bit of devolution and delegated roles going to the local governments. But then the findings critical to this is that the finding from the two countries revealing the complexity of sanitation subsector and the need for synergistic collaboration between the different ministries, national agencies, vertical collaboration with the local governments, and more importantly, harmonization of these policies and regulations to improve sector governance. And so if that be the case, then is there indeed some lack of natural leaders and champions for realization of this harmonization? I think we can see this if we go to the next slide, where we have some of the detailed findings. So some of these findings were kind of analyzed along the CWIS principles around inclusivity, equity, safely managed sanitation, responsibility and accountability, and so on and so forth. And what we realized is that, like in Kenya, there is a concerted effort by utilities towards creation of poor units, but this has really not been demonstrated in terms of improvement in service provision. While in Nepal, we realized that some of the policies are there that are trying to align to the new constitution, but they have not really defined specific roles and involvement of different sector stakeholders. In terms of gender, the policies really make reference to this, but nothing is really seen as a distinct output from the monitoring work in Kenya. Whereas in Nepal, the monitoring systems are a bit low. In terms of accountabilities, the policies kind of allocate some of these roles, but this is not reflected in the way that services are being designed on the ground. And of course, when you go monitoring, you find that sewerage is more prominently referenced than you find with other sorts of sanitation. In terms of resources, sewerage seems to be attracting more attention than other technologies, thus defeating the spirit of inclusive sanitation, CWIS, in both countries. And in terms of political will, you realize that there is commitment towards achieving the universal access as per the UN SDG 6, as well as the constitutions. But this is very much not based in the policies, rather than again having these policies translated into action on the ground. So so with this minimal kind of policies reflecting but no action, we try to look at some of the barriers, and we came up with a number of barriers where we realized that there is a threat to autonomy. So whereas these policies are domiciled in different ministries, they fear coming together because each seem to be feeling that they are the sole decision makers around the subject of sanitation. There is also the invisible and unobvious aligned goals and incentives So key actors do not see immediate gains in sanitation, for example, in environment, they really don't see that. There is an obvious misunderstanding between resource providers occasioned by lack of data. More prominently, as I've said, sewerage is more prominently featuring. So sanitation lack data, which then means people really don't understand to what extent and scale it needs attention. And of course, lack of domain status, where there is also sector misunderstanding between players over who has the right or over the sanitation sector more than the other, and so the resource competition comes in. And of course, there is also place and nature of sanitation among the key urban basic services. It has always lagged behind. We know all this, that when you put it against water, electricity, roads, access, sanitation will always be an afterthought. And so looking at this, we kind of came up with a number of what we thought could be a great levers towards realizing multi-sectoral coordination, hence providing platform for improved planning for investment. And some of them, the leading one in this is, of course, the political leadership from the top, where the ministries are able to sit together and harmonize their policies and look at the agencies under them as in a way that they are able to have common vision for sanitation. There is also diversity in terms of data sources, and this needs to be harmonized so that we realize complementarity from these sources rather than conflicting information. We also came up with a third lever that looks at how co-benefits and of course interfaces, interlinkages between sanitation and other sectors.
Sorry about that. You want to have, can you sum up in 10 seconds? Yeah.
So as I wind up, it's also the issue of alignment and having information, and of course also sustained investments. There is a shift, there should be a shift in the cultural and traditional perception of sanitation place among other key, as a key service. And of course, identifying sanitation champions, this has been lacking, and some of them are just coming up in the two countries. And of course, the last one is putting in place a robust intersectoral governance structure. This has been in Kenya before, but I think there has been, with the new constitution, it kind of lost its bearing, and probably it will be coming back. I think I will have to stop there and give it back to you, Deepa. Thank you very much for listening.
So much, Simon. Thank you. I'm going to stop sharing screens. I'll invite all the online participants to share your screens so that everybody can see more than just a name, and they can see you. And we can see the online participants as well. I'm going to invite, I'd love other questions from the audience for our panelists. I'll invite maybe Andy and Adnan to please come to the...
There might be some chat.
Yes, let me open up chat. But meanwhile, other questions from the audience that you have? Yeah, Rachel, please go ahead.
Sure, thanks. I'm Rachel Collins with Advice too, and thanks for the presentation. One theme that I saw in multiple presentations was around one theme that Andy mentioned as an accelerator was data and information, and that also came up in Simon's presentation and also Alan's. And I would just love to see or hear about either one of the three of you or others had examples specifically of what data is being used, like what's most critical, how that's being shared, just a little bit more about those systems and experiences. Thanks. I don't know who wants to take that. Any of you or
what I'm like.
Well, I think I would say in Bangladesh, the country, at the country level, they'll be able to share some examples of how data is being used, but I can tell you, like conceptually, I mean, from the public health perspective, it's understanding what are the most critical risks along the sanitation chain. We would recommend through sanitation safety planning at the local level, so city or other local levels. So you can understand what are the biggest risks, what are the biggest, so risk times like, consequence times likelihood. So that would advise the investment choice. For example, if it's low, it's just to enforce a regulation is probably low cost, but could have much bigger impact compared to building a wastewater treatment plant, for example. So we would recommend identifying the biggest risks along the sanitation chain to public health, identify the agency responsible for routine monitoring at that point for the biggest risk, and then share that information. Well, if it's through service providers who are collecting that information, and the regulator sharing it to regulator, and regulator, should be shared up to national level. But that's the theory. Anyway, but I'd love to hear practically how data and information is shared.
Yeah, I wonder, Alan or Bethlehem or Simon, do any of you want to respond to that as well?
Yeah, sorry, Deepa, could I just come in terms of yes. So I did talk about information and data issues, and one thing that has been quite a challenge in having a strategic data hub for sanitation or sanitation and wastewater, for that matter, is the fact that in most of these countries where we are working and carrying out these assessments, sanitation has always been hopping from one ministry to the other. And so this means then that as one ministry strives to establish a monitoring framework and build a footprint, even at the local level for monitoring sanitation along the sanitation value chain, you realize that at one point the sanitation as a subsector is moved into another ministry and they start afresh. I will give an example of Kenya, where Ministry of Health has a very strong footprint up to the local level, with full capacity and capable of carrying out robust monitoring for sanitation. But then you realize that sanitation as a function rests with the Ministry of Water and Sanitation and Irrigation. So then, which has very limited footprint apart from the utilities in the town. So then you find that the data that can come from the Ministry of Water, for example, is that as informed by the utilities, whereas that can come from the Ministry of Health, again, is probably biased towards public health issues rather than looking at the entire service as a whole. And so this has been a challenge in terms of getting our acts together, getting the credible information that we need to spur planning and investment into sanitation. And this can only be solved by coordination, because one has strong footprint and presence, the other one has the function, to a sectoral function. So once they can coordinate and collaborate, I think we can realize some good advantage around their work. Over to you.
Yes, please go ahead. Tanvir, go ahead. Yes, yes.
I can, if you want, I can just supplement this discussion on data information. So I think what it's meant in the acceleration framework in GP6 is that we need to have a consistent, coordinated, or let's say a unique data point where we can collect information. In many developing countries, what we have is fragmented data sets, both at the local level and the national level. So what the acceleration framework tells us is that we need to bring all these different data sets and have a national or a coordinated where from which we can actually derive data which is nationally represented. And the other thing is that we have to make our decisions based on data. So it's called data-driven decision making. And to have that, we need to have that reliable, consistent source of data, and when it's put in one place and it is nationally represented. For example, in Bangladesh, we have the sanitation dashboard, which is now developed. You can log in and you can see the status of the municipalities, at least several sections, which is developed under the PMTF grant. Also, the IMIS, which is also contributing to this, where you have information of the municipalities at one place. And where if you want to make a decision, you go there and look at the status of future planning, feasibility study, that sort of. So, well, the basic thing here is that we cannot make a decision based on conjecture or something that is hypothetical. It has to be based on data, and also the monitoring mechanism has to be coordinated. So we have to develop indicators for that, and so that the data directly feeds into, so the monitoring data feeds into a system where we can know the status of what's improving and not improving.
Thinking of being provocative, I think, on data, we keep thinking of data producers as just people that are entering data somewhere because somebody else has to see it, or an integrated system somewhere needs it. And I think there's an opportunity to shift that paradigm a little bit and think, because data is not external, the quality of the data is a function of the service system that's generating that data, and it's being generated for the people that need to use it first. So if you optimize around I'm going to say producers because often these are for data users at the lowest levels, you're probably then building up systems. And I'm curious, I'd love to, just a thought, Bethlehem, and I know Alan, both of you have your hands up. Bethlehem, I want to specifically first maybe hear from you, because what is the ministry doing differently there? Because are you just going back and asking for more quantitative data from cities without giving them any systems to do that? How are you thinking about data in Ethiopia?
Thank you, Deepa. In fact, there is a management information system development within MOWI for the water and sanitation. But, as I have mentioned in my presentation earlier, we don't have any sanitation indicator, specific sanitation indicator that we would like to collect from, for example, from utilities, because, especially for the urban sector sanitation, we would like utilities to be more involved. But as the earlier presenter discussed, we need to have integration. In Ethiopia, we have initiated this integrated urban sanitation and hygiene strategy, which tries to coordinate different sectors. So probably we can answer that coordination and data information gathering from the different actors through that coordination mechanism. So there is an initiation work to create a secretariat for this coordination activity. So data and information on the WASH system, there is also a work in progress to have this MI system in Ethiopia. So probably these two things are very important, but on the other hand, for example, to help utilities report and for us to support them, maybe we need to have some important indicators on sanitation. This is probably a work that we are currently doing with the support of CWIS technical assistance, and probably I think utilities And the city can have an opportunity to report on these things, in my view, Deepa.
Thank you, Bedlam. I do want to, Alan, I see your hand up, but I do want to give another. Rachel, do you want to ask your question? And maybe
Oh, sure. So at the beginning, I think when Bethlehem was speaking, you talked about how where there are quantitative data gaps, qualitative data is being collected. I was wondering if you could just mention some of those metrics that you're showing.
And it's less about sort of filling quantitative data gaps, because qualitative data, I think, is valuable on its own, right? Because it's not so much as a fill up for quantitative data, because anything, when you start wanting to track governance, you're no longer asking, the outcomes are qualitative questions that you want to track, the inputs are qualitative. So you start asking questions like, that was one of the examples that I provided on the maturity of your financial management systems is a good example, right? Like another example is, do you have a mechanism to report, because most utilities have a board of directors, right? So are you reporting back on environmental and equity risks to the board? Could be a question that you ask. So these are examples of qualitative aspects that give you a really good insight into the maturity of what's going on and whether that's headed in a direction that you think is consistent with national priorities. And I think they work better, particularly in low resource contexts where local governments, both rural or urban, don't have the systems, don't have the capacities. I actually think, and Tanvi, you're right, the IMIS is a very novel innovation. It's top down. It's trying to say, we're never going to build up these systems bottom up, but can we create this channel? And I think we could do a whole session just around data, and that could just be a conversation. But yeah, I've done, Rachel, and I don't know, Alan, do you want to comment on the quantitative, but also feel free if you want to comment on the previous question, Alan. Alan, do you want to come in?
Thanks, Deepa. Yes, the subject of data can be simple, but it can also be complicated, not only because of the sector, sanitation sector, that is, if you like, still in its nascent stages. So we're still trying to bring it up to the level of its bigger brother, the water sector, that is more developed, has more indicators, more data being collected. But if I start off firstly with the question that was asked earlier, and I think you all captured it very well in terms of the data that needs to be captured. Andrew mentioned the public health side of data, so that's very important. There are also environmental health aspects that will need to be captured. These will mostly be captured at the strategic level. But like Simon and Deepa mentioned, then you start coming down to the more practical day-to-day levels of data that are required for the cities, for the ministries. And so on the latter, that I just wanted to make a point that these data systems can be very crucial for coordination at the ministry level. So the systems that Bethlehem are thinking of establishing will not only be about tracking the main indices for public health or environmental health, but they'll also be very useful for coordinating the different actors within that space, just like Simon mentioned. And so in thinking about those indications, you then start to also think about the aspects of quantitative versus qualitative data. For sure, there will be aspects where you need to delve a bit deeper to try and understand why certain things are. And in previous work that we worked with Deepa, part of this was as simple as trying to overlay toilet data on top of, say, data on the incidences of cholera in an area or diarrhea diseases. And that you find trying to do that then answers quite a number of questions that a specific indicator may not give you on its own. Sorry, I may not have answered the question directly, but I was just trying to paint a picture but the question can be very complicated. And this is where the local interests, the contexts and interests and priorities will then guide and shape how this is being done. Obviously, trying to link this with the global protocols and the well-known protocols like Simon shared on the CWIS framework, all the SDG frameworks and the likes. Thank you very much.
Thank you,
Back to you.
Alan. Thank you. I know we're 3 minutes over time, so I want to give a huge round of applause to the amazing panelists for being here with us today. Thank you all so very much. And the audience, thank you guys for turning up on the 4th day of a conference and being here with us. So grateful to each and every one of you. And thank you. Thank you.
And thank you to Deepa.
Yeah.
Thank you very much.
Thanks, everyone. Thanks, Alan.
Thank you.
Thank you very much.
Thank you. Thank you.
Yeah, thanks to you guys very much
Yeah.
for facilitating that dialogue. I mean, it's really good.
Qualitative and quantitative data.
This is a long. big topic.
በጣም ገና ነው።
We're all learning this.